Hi, this is Tina Garrity. I will be presenting Independence Blue Cross's Keystone Essential RX HMO for 2026. The Keystone 65 Essential RX HMO POS is available in all 5 counties of Philadelphia at a $31 per month premium. It carries with it no deductibles for medical or prescription drug. Primary care physicians are a $0 copay. Specialist visits are a $35 copay. Keep in mind that although this is an HMO product, there are no referrals needed for specialists, so you can go directly to your specialist physician. Outpatient hospital services are available at a $350 copay if using the hospital. But if you're having an outpatient surgery using a surgical center, you'll pay a $290 copay for that service. Emergency room visits are a $115 copay. The copay is not waived if admitted to the hospital. For outpatient diagnostic radiology services, you will pay $30 for an x-ray and $300 for a CAT scan or an MRI. Lab work continues to be available at a zero copay by using one of our in-network labs. Specifically, you need to use the lab that your primary care physician has chosen. LabCorp continues to be a participating provider. For inpatient hospitalization, you will pay a copay per stay of $650. That means if you go to a participating hospital and you stay one night, your copay will be $650. If you stay 6 nights, your copay will continue to be $650 per stay. For outpatient rehabilitation, such as physical therapy, occupational therapy, and speech therapy, this plan continues to have a $25 copay per visit. The over-the-counter benefit is $60 quarterly allowance. The maximum out-of-pocket on this plan, which means that medically speaking, should your copays hit $8,500, that will be the most money that you would pay in one calendar year. All expenses medically proven by Medicare after that point would be available to you at a zero copay. In an HMO, you must use in-network coverage, except worldwide emergency urgent care coverage is included in this plan. Let's go over the prescription drug benefits. Prescription drug coverage with the Keystone 65 Essential HMO has no deductible attached to it. For Tier 1 and Tier 2 generic drugs, when using a preferred retail or mail order, you will pay a zero copay. For Tier 3 medications, you will pay a 25% coinsurance. Tier 4 is 33% coinsurance, and Tier 5 is 33% coinsurance as well. Keep in mind that insulin continues to be covered at a $35 copay per month. The true out-of-pocket limit for 2026 for prescription drugs has been set at $2,100, which means that if your copays reach this maximum out-of-pocket, as long as your drug is on the formulary, all of your copays after that for the calendar year will be zero. Dental, vision, and hearing benefits are included in this plan. You are eligible if using an in-network dentist for one exam every 6 months and a cleaning, as well as consultation every 6 months, 2 consultations and 1 fluoride treatment, all at a zero copay. You will also receive 1 set of x-rays every year and a panoramic set of x-rays every 3 years, all at a $0 copay. The Essential HMO also has a $2,000 combined in and out of network allowance. When using an in-network provider, you will have a $2,000 allowance for comprehensive coverage in which you will not pay any percentage of the bill. In other words, if you get a filling, a root canal, a crown, extraction, implant, partials, some oral surgery even, you will have an allowance of $2,000 to use, and you will not have to pay any portion of that bill up to the $2,000 allowance. If going to an out-of-network doctor, you will have 50% coverage up to the $2,000 for any preventive and comprehensive coverage. A routine eye exam at a Davis Vision provider is included in this plan. One exam every year at a zero copay. One pair of eyeglasses, frames, and lenses, or one pair of contact lenses is covered each year. Eyewear purchase from the Davis Vision collection is covered in full. Eyewear purchase from VisionWorks has a $250 allowance per year. Eyewear purchase at a Davis Vision Network provider has a $150 allowance per year. And contact lenses purchased instead of eyewear have a $150 allowance every year. Hearing aids are also available on this plan. The Essential HMO through the True Hearing Network provides a routine hearing exam at no cost, as well as fittings and evaluation unlimited the first year at a zero copay. If buying hearing aids from True Hearing, you can purchase them on the Essential HMO up to 2 hearing aids every year, 1 hearing aid per ear at $399 or $699 copay. The over-the-counter allowance is a use it or lose it benefit. You can use the over-the-counter allowance at participating CVS, Walgreens, Walmart, Dollar General, Family Dollar, and more. You can also use this online or via the phone. The $60 quarterly allowance is a use it or lose it benefit. It does not roll over from one quarter to the next. Also, Teladoc Health provides telemedicine at a zero copay on this plan. Independence Blue Cross also allows you to earn up to $250 for the year in gift cards for doing your preventive maintenance. The One Pass Fitness membership continues to be included, which offers you a basic gym membership at no cost to you and more. Transportation is available on this plan for all members. It includes 12 one-way rides, which is 6 round-trip rides, of course, at a medical facility. And that is available through the company Round Trip. A food and produce benefit is also available for those members who have low-income subsidy or extra help. Those members will receive a maximum of 12 weeks of food and produce per year. If interested in hearing more about the Essential HMO for 2026 or enrolling in the plan, please reach out to us via our website, email, or contact us by phone. Thank you so much for your attention.